Alright, this is a lecture on managing a nursing team. I broke it down into 3 different small lectures so that it's a little bit easier for you to manage. So let's talk about what type of leader you might be. Just think about that for a second. So first of all, leadership occurs anytime a person attempts to influence the beliefs, opinions, or behaviors of another person or a group. Leadership is a combination of intrinsic personality traits, learned leadership skills, and characteristics of the situation. The function of a leader is to guide people and groups to accomplish common goals. For an example, an effective nurse leader is able to inspire others on the healthcare team to make patient education an important aspect of all care activities. It's important to note that leaders may not have formal authority granted by the organization, but are still able to influence others. The job title, like nurse manager, does not necessarily make that nurse a leader. The nurse's behavior determines his or her ability to be viewed as a leader. Let's talk about management. It refers to activities involved in coordinating people, time, and supplies to achieve desired outcomes, and it involves problem solving and decision-making processes. It's maintaining control of the day-to-day operations of a defined area of responsibility to achieve established goals and objectives. Planning and organization is what's to be done, who is to do it, and how it is to be done. Each of these spokes would represent a member of the healthcare team, with all of them directing the decisions to the center of patient care. As organizations become more decentralized, activities are transferred from the chief nursing officer to the nurse manager or the supervisor, and perhaps even to the bedside nurse. Decentralized units encourage autonomy, like with the charge nurse overseeing admissions on a unit versus the nurse supervisor or the chief nurse executive. That's more of a centralized unit. Evidence-based practice is used, and the difference is seen when the decisions are made closer to the bedside. Registered nurses promote and implement different strategies to promote education, health, and wellness. Formal leadership is appointed to an approved position and given the authority to act by the organization. Managers plan and organize what's to be done, who's to do it, and how it's to be done. The first level of management are visible on the floor, visit with patients, and perform patient satisfaction. Round with staff and make on-site decisions to make working and staffing conditions better. And some of their duties include staffing, employee performance reviews, accounting for safe and effective care. Mid-level managers are more involved with department-wide decisions, and upper-level management is concerned at a more higher level, like the CFO and the president. There are 5 management functions. Planning is defining goals and objectives, developing policies and procedures, determining resources allocations, and developing evaluation methods. Organizing is identifying the management structure to accomplish the work, determining communication processes, and coordinating people, time, and work. Staffing is identifying activities required to have qualified people accomplish the work, such as recruiting, hiring, training, scheduling, and ongoing staff development. Directing encourages employees to accomplish goals and objectives and involves communicating, delegating, motivating, and managing conflict. And controlling, performing employee performance reviews, analyzing financial activities, and monitoring quality of care. Systems theory is a type of organizational theory. Interdependence is much like the body, where each system depends on the other for the entire body to function properly. Some open system examples: internal changes are like opening an urgent care to decrease emergency department patient loads, and external changes are like when insurance does not cover the stay of heart cath patients who receive cardiac stents. The hospital must react then and change how it does business, like adding more ACU nurses and expanding hours in outpatient areas. Healthcare organizations do not use closed systems. The definition of a closed system is when the system is totally independent of outside influences. Click on pause and take a few minutes to answer these questions. From systems theory and other similar theories, shared governance has evolved. Shared governance is a decentralized organizational model. Decisions are made closer to the patient care level and are made by the individuals who provide the service. This involves all levels of nursing like ADN, BSN, MSN, case managers, and the like. It demands that the nurse is involved versus just providing participation or just going with the flow. And these are organizations that, there are some organizations that mislabel their governance structures, unfortunately. They may be labeled as shared governance, but they really don't possess many of the characteristics of a true shared governance. Advantages of shared governance are improved patient care. The nurses are able to control the practice. Care standards are driven by nurse committees who look at research and adopt evidence-based practices, and care decisions are not driven by administration. Another advantage is improved nurse communication. Oftentimes committees are formed to look at different aspects of nursing practice. Aspirus has a number of committees. They are called practice, leadership, advanced practice, research, education, quality, and coordinating council committees. Another advantage is improved job satisfaction, where nurses feel involved in the organization and they feel that their efforts and knowledge can impact the care that's provided, and there's decreased nursing turnover. A disadvantage is implementation requires a cultural change within an organization, and this can take years to implement. It also requires a new organized structure, which is hard for administration to give up their power. And it's hard for some nurses that don't have any management experience to adjust to this, because it does require some education. That's it for the first part of this